Transferring a client with limited mobility between a chair and a bed or cot, or between chairs, requires certain skills and caution. This video will demonstrate necessary skills that will help build your competency to safely perform these tasks. A key to efficiently helping clients move or relocate safely is good body mechanics, such as alignment, balance, and coordination. Alignment is good posture. To practice good alignment while standing, keep your knees slightly bent and stand with your feet shoulder-width apart. Put your weight evenly distributed on both legs and keep your shoulders straight and centered over your hips. Your stomach muscles should be tightened with your buttocks tucked under while your head is up and your chin level. Balance is stability achieved through the even distribution of weight. Having a wide base of support and keeping the heaviest part of your body, or center of gravity, close to your base of support helps you to stay balanced. When standing, your feet and legs are your base of support and your torso is your center of gravity. Therefore, spreading your legs apart and bending your knees to bring your torso lower helps you to remain stable on your feet. To improve stability for the client and to prevent falls, a gait belt can be used. The use of gait belts are encouraged for helping clients stand and walk. There are a variety of gait belts available. Familiarize yourself with the type you will be using.
Hello.
Hi.
I'm Keisha.
Hi, Keisha.
I hear that you're ready for dinner.
Yes, I'm really hungry right now, yeah.
Do you need any special assistance?
It would be nice. I'm a little wobbly right now from walking.
Well, I can support you using this belt.
Okay.
And I'm going to tighten this to secure it just a little bit. How's that feel? And we're going to get up on the count of 3.
Okay.
I want you to plant your feet shoulder width apart.
Okay.
1, 2, 3.
Gait belts should be used by putting the belt around the client's waist over his or her clothing with the buckle in front. Thread the belt through the teeth of the buckle and continue to feed the belt through the buckle and test to see that the buckle is locked. Be sure the belt is snug with just enough room to get your fingers under it. Grip the belt tightly at the waist, aligned with the hips of the client, and use your body mechanics for balance and stability. Bend your knees and keep your back straight. Lift or move the person with your arm and leg muscles, but do not use your back muscles. Do not twist your body when you move or lift the person, as this will decrease stability and can result in injury to you or the client. When you are done moving or walking with the client, remove the gait belt. When transferring a client, safety is the top priority. Prior to moving a person, check the following aspects of the planned transfer. Plan the movement, including the order of specific tasks and who will carry out each task if there is more than one care assistant. Get equipment ready, if equipment is to be used, and ensure the equipment is available in good order with any required accessories in place and ready to use. Prepare the environment by positioning the furniture. For example, if you're transferring to or from a cot, make sure that the cot is stabilized against the wall, and then check that the route and access ways are clear and that the destination is ready. Prepare the client by telling the client what will happen, gaining their permission, and letting them know what they are expected to do. Communication with the client throughout the transfer helps minimize risk. Ensure that the client's clothes and footwear are appropriate for the task and that they have any aids they need. Always assess the task at hand, and if you think any task you are performing may be unsafe, do not hesitate to ask for help. Safety is always first.
Hi, Mr. Stevens. I'm Keisha. Do you remember me? We met yesterday?
Yes. Hi, Keisha.
Hi.
Hi, Keisha.
It's dinner time.
Okay.
I'm here to take you to dinner, so I'm going to help you get into your wheelchair. Is that okay?
Yes, that's okay.
Okay. So I'm going to put my hand behind your back to support you as we swivel around. Okay. And I need you to scooch to the end of the bed as
Okay,
much as
yep.
you can.
There, how's that?
Okay. And I'm going to use this belt and put it around your waist. Up, up. You feeling okay?
Yeah, I'm good.
Okay. And I want you to push off as much as you can, and then once you're standing, I want you to put your hands on my shoulders, okay?
Okay.
All right. We're going to do this on the count of 3. 1, 2, 3. How's that? You doing okay?
Yep.
Okay.
I'm good.
Now we're going to swivel around towards the wheelchair, okay?
Okay.
And let me know when you feel the backs of your knees hit the back of the wheelchair.
Okay, I'm there.
And then I want you to take your hands and feel for the arms of the wheelchair.
Okay. Okay.
And then I want you to gently ease down. Okay?
Yep, I'm good.
Okay.
When moving a client from a cot to a chair, first assess the situation and determine that everything is prepared for the transfer. Then clearly communicate with the client about what you will be doing. When transferring to a chair, it is preferred to use an armchair. Also, the receiving chair should either have locking wheels or no wheels at all. The chair should be positioned against the wall, or you should have a second care assistant helping to stabilize the chair. When transferring a client to a wheelchair, be sure to lock the wheelchair brakes before tending to the client. There are several methods for foot and body placement, but foot block and knee-to-knee will be demonstrated here. Start by blocking the person's lower extremities to prevent him or her from slipping. To do this, face the person, placing your feet toe-to-toe. Turn your toes slightly outward to create a supportive base and position your foot closest to the chair farther back than the other foot. Bend your knees deeply so that they rest against or near the client's knees. Have the client lean toward you. If you are working with a coworker, each of you blocks one of the client's feet. Tell the client that on the count of 3, you can push down on the bed with your hands while assisting him or her to a standing position. On your count of 3, straighten your legs, helping to lift the person to a standing position. Tell the client to place their arms on your upper arms or shoulders to steady himself during the move. Taking small steps together, pivot around until the client is right in front of the chair. Ask the client to tell you when they can feel the chair against the back of their legs. Help the client to feel for the arms of the chair, one arm at a time, while keeping your other arm around their waist for support. Put your head to the client's side closest to the chair so that you can keep the chair in sight during the move. Lower the client into the chair by bending your knees and keeping your back straight. Assist the client to position themselves in the chair so that their back is against the back of the chair. Place the client's feet on the footrests if used. Be sure to lock the wheelchair brakes. Remember, it's important to always listen to the client. Be sure to always let the client know what you are going to do next.
All right, Mr. Stevens, how was dinner?
It was okay.
Just okay?
Yeah, it was okay.
Oh, we're going to get you back into your bed so you can get some rest. And if you could lift your feet up, I'm going to move these out of your way. And I'm going to put your belt back on you
Okay.
so I can assist you in getting back on the cot. And I need you to lean up just a bit.
Okay.
There you go. And we're going to do this the same way we did it on the way to dinner. You put your arms,
Wait, should I try to push off the wheelchair?
yes, you should, but you put your arms on my shoulders once you're standing, okay?
Okay.
All right.
Ready?
We're going to do this on the count of 3.
Okay.
1, 2, 3. How's that?
Okay, good. Yep.
Okay. And we're going to swivel back towards the bed.
Okay.
All right. And I want you to back up until you feel the back of your knees hit the back of the bed.
Okay, I'm good.
Okay. All right. And then I want you to ease down as gently as possible. Okay.
Oh, okay.
You okay?
Yep, I'm okay.
All right. And we're going to take this off of you.
Okay, thank you.
And then we're going to swivel around so you can get comfy in the bed.
Okay, just give me a second here.
Okay.
Oh, good. Okay. Ready?
All right.
Good. Yep, that's good.
You feeling okay?
Yes, I'm good now. Thank you.
Okay, you're welcome.
Thank you.
All right. You have a good night, Mr.
You
Stevens.
too.
When moving a client from a chair to a cot, first assess the situation and determine that everything is prepared for the transfer. Then clearly communicate with the client about what you will be doing. Start by blocking the person's lower extremities to prevent him or her from slipping. To do this, face the person, placing your feet toe to toe. Turn your toes slightly outward to create a supportive base, and position your foot closest to the cot farther back than the other foot. Bend your knees deeply so that they rest against or near the client's knees. Have the client lean toward you. If you are working with a coworker, each of you blocks one of the client's feet. Tell the client that on your count of 3, they can push down on the arms of the chair with their hands while assisting him or her to a standing position. On your count of 3, straighten your legs, helping to lift the client to a standing position. Tell the client to place their arms on your upper arms or shoulders to steady himself during the move. Taking small steps together, pivot around until the client is at the side of the cot. Ask the client to tell you when they can feel the cot against the back of their legs. Lower the client into the cot by bending your knees and keeping your back straight. If the client needs assistance to lie down, place your arm, closest to the head of the bed, behind the client's back. Place your other arm under the client's knees. Pivot the client on the cot and lower to a reclining position. Position the client comfortably on the cot.
So how was dinner, Mr. Stevens?
Oh, it was all right.
Oh, good.
Yeah, it was good. How about can I sit in this chair a little bit until my food settles a little bit? I don't really want to lie down just now.
Sure.
Okay, that'd be good. Yeah, I think I can sit up for a little bit.
That's probably a good idea. So I'm going to, there you go. Thank you. I'm going to put
Wanna
the
use
belt
that?
back on you. Yes, thank you. Thank you. Put this around your waist. And we're going to do this on the count of 3 again.
Okay.
Okay. 1, 2, 3. Hold on to my shoulders. You steady?
Yep, good.
Okay. And we're going to swivel around towards the chair. And then we're going to back up until you feel the backs of your knees hit the chair.
Okay.
All right. And then I want you to ease down as smoothly as possible.
Oh, good.
How,
Oh. I need to sit up a little bit. I just kind of like slid down.
Okay.
I just need, can you pull me up, pull me forward? I can help.
Sure.
Okay.
Let's adjust you a bit.
Okay, good.
Is that better?
Yeah, I'll be good.
Okay.
I'll be good.
All right, and I'm going to take this off of you.
All right.
Can I get you anything else?
No, I'll just sit here for a little bit, but make sure somebody comes and gets me back into bed maybe in a half an hour or something like that.
Absolutely.
And maybe if they come, they can maybe bring me a drink.
Okay.
Okay, I could drink something maybe a little bit.
Okay. All
Okay,
right.
All right.
I'll check on you later.
All right, thank you.
When moving a client from a chair to another chair or a sitting position to another sitting position, first assess the situation and determine that everything is prepared for the transfer. Then clearly communicate with the client what you will be doing. Start by blocking the person's lower extremities to prevent him or her from slipping. To do this, face the person, placing your feet toe to toe. Turn your toes slightly outward to create a supportive base and position your foot closest to the destination chair, farther back than the other foot. Bend your knees deeply so that they rest against or near the client's knees. Have the client lean toward you. If you are working with a coworker, each of you blocks one of the client's feet. Tell the client that on your count of 3, they can push down on the arms of the chair with their hands while you assist him or her to a standing position. On your count of 3, straighten your legs, helping to lift the client to a standing position. Tell the client to place their arms on your upper arms or shoulders to steady himself during the move. Taking small steps together, pivot around until the client is at the side of the destination chair. Ask the client to tell you when they can feel the destination chair against the back of their legs. Put your head to the client's side closest to the chair so that you can keep the destination chair in sight during the move. Lower the client into the destination chair by bending your knees and keeping your back straight. Position the client comfortably in the destination chair. Once the client has been transferred, ensure the client's comfort and good body alignment. Adjust any equipment properly for safety. If the client is in a wheelchair, make sure the wheels on the wheelchair are locked. Place the client's method of calling for help within reach. Clean up your work area and wash your hands.